Imagine that you're in charge of an ICU at a large hospital. Now, your city is seeing a surge in COVID-19 patients because your local flagship university decided that they were going to have in-person classes rather than switch to everything online. So it's your job to decide which of the prospective patients gets hooked up to ventilators and which ones don't. In a very real way, what you're deciding is who will live and who will die. So on Monday morning, 2 patients show up at exactly the same time, and you have 1 ventilator available, so you have to figure out which one gets the ventilator. Patient A is 23 years old, and other than having a nasty case of COVID-19, they don't have any underlying health conditions. Patient B, on the other hand, is 70 years old, and they have a lot of severe health conditions. So looking at their chart, what we see here is severe congestive heart failure, severe chronic lung disease, and severe cirrhotic liver disease with multi-organ dysfunction. So according to the U.S. Civil Rights Office, you're not supposed to discriminate on the basis of age. However, given the underlying health conditions and the difference there, you think that you should really give the ventilator to patient A, so you do. Was that the right decision? So to figure that out, we're going to need to take a look at the principle that would explain and justify the decision that you made. So let's look for a principle. One principle could be this. It could be distribute ventilators in a way that maximizes expected years of life. And we can call that the life maximization principle. Now, it's very clear on that principle why you saved patient A rather than patient B. Doing so saved or maximized expected life years saved. Is the life maximization principle true? Well, let's put it to the test. On Monday afternoon, another patient arrives at the ICU. We'll call them patient C. Now, thing is, patient C is very similar to patient A. Like patient A, patient C is 23 years old. Like patient A, patient C has only one negative health condition, and that's COVID-19. But there's one big difference. Patient A was male, patient C is female. And it just so happens that in the United States, females live on average 5 years longer than males. So according to the life maximization principle that we started with, what should you do? It seems really clear. You should unhook patient A, killing him in order to give his ventilator to patient C, saving her. But it seems to most of us that that's the wrong answer. That seems horrifying that we would do that. And so it seems to us, because of that this life maximization principle can't be the right principle. It can't be correct after all. So what principle could we give instead? Well, how about this one? It's wrong to kill an innocent individual in order to prevent another innocent individual from dying. We can call that the anti-murder constraint, right? So the anti-murder constraint would tell you why, it would explain and justify, if true, why unhooking A to give the ventilator to C is the wrong thing to do. But one thing you should notice is that the anti-murder constraint says nothing about the case that we started with. And so because of that, you decide that you're going to keep this life maximization principle, but violate that principle in cases when following it would involve murdering somebody, right? So now we've arrived at this hybrid principle. So your first thing you're going to try to do is to make sure that there's no murder involved, and then once you've satisfied that constraint, you're going to try to save the most lives. Like, you're going to try to maximize expected years of life. All right, so now we have a hybrid principle. Is that hybrid principle true? Well, let's put it to the test. All right, so it's now been 3 weeks since the week when patients A, B, and C arrived in your hospital. Patient A is just going to be released today, so he's really excited about that. But patient B and C are now deceased. So what you decide to do is you're on your lunch break, and you decide that you're going to take a look at some spreadsheets. So you want to take a look at some spreadsheets about hospital admissions data for your ICU. You take a look, and you're scrolling, and what you find is that over the past 3 weeks, there were, on average, 10 prospective patients competing for 5 available ventilators each day. You know, it's not great, but it's the best you can do with the resources that you have, it seems. Your staff followed your instructions perfectly. They implemented the hybrid theory. Healthier patients were given ventilators, and nobody was murdered. So Good. Job well done. But then you realize something. Even though there was no explicit discrimination in your hospital on the basis of class, poverty is correlated with cardiovascular risk. And because of this, what ended up happening was that in all of the one-to-one competitions where two patients needed to have a ventilator, if one was richer and the other was poorer, the richer one always got the ventilator. Just so happened. And then you realize something else. Even though there was no explicit discrimination on the basis of race, in the United States, race is also correlated with poverty. And so, due to the random pairings of patients and due to these correlations between race and poverty, the percentage of black patients who were offered ventilators was far lower than the representation in the pool of patients who arrived in your hospital. So they were underrepresented, underserved, based on their representation in the population. So you're kind of horrified by all of this because you thought you were just giving a fair, kind of race-neutral, class-neutral policy. But by doing it that way, what you ended up doing was creating a situation where health inequalities were actually exacerbated rather than diminished. So at this point, you're stunned. You don't know how you're going to be able to come up with a principle that will help you navigate these cases. But then you realize something else. You realize that your staff have interpreted your anti-murder constraint in such a way that they haven't been removing patients from ventilators even when it would be appropriate to switch them to palliative care. So you have all these cases where patients are their condition just worsening and it's not going to get better. Like you're sure that it's not going to get better. But instead of taking them off the ventilators and switching them to sort of comfort care, you leave them on there, and then they stay on the ventilators until they die. And the consequence is that the treatment of them is less humane than it could be, and there's lots of individuals whose lives you could have saved if you had unhooked them a little bit earlier. All right, so your quiz for this week is to come up with a principle or a set of principles that explain and justify whatever you think the right answer is for what the policy should be for this ICU. And I want it to be a principle that will get the right answer in every single one of the cases that we talked about, all the permutations, right? There will be explicit instructions for how to submit this on the course website. So thank you, and I'm looking forward to reading them.